Please welcome Executive Director of the New York City Mayor's Office of Food Policy, Kate MacKenzie, and Research and Evaluation Strategy Manager at the New Jersey Office of the Food Security Advocate, Dr. Jenny Schrum, for a conversation moderated by Built Environment and Food Systems Coordinator for Boulder County Public Health, Rachel Arndt.
Great, thanks for joining me today, Kate and Jenny. We've heard a lot about connections today, both between the food system and adolescent health, as well as the food system and environmental challenges. I'm just wondering if you could talk a little bit about how your work connects to these areas and just share some of the challenges with us.
Sure, thanks so much. It's really a treat to be here. So New York City Mayor's Office of Food Policy supports a 10-year food policy plan called Food Forward. And what that plan did for us was take the multifaceted food system and provide us with a roadmap for addressing not just one issue about what we eat, but the myriad of issues that our food system is connected to and that a city government can contribute towards. So whether it is thinking about the 230 million meals a year that we're serving to New York's most vulnerable, those include our public hospital system, in which plant-based meals right now are the default in our hospital system, our school system, which is the country's largest, that offers plant-powered Fridays and meatless Mondays, and the power of meal procurement that offers us, which is very closely connected to our next priority area, which is around food and climate. And I'm so gratified to see this summit really centering food and climate also. We support our watershed with best management practices in agriculture, and that's food policy, right? So making sure that some of our farmers are using the absolute best practices to protect our watershed. And then also, I would say, food education. We have a plan for all of our public schools to not just make sure that what we're serving in our cafeterias is delicious and healthy, but also to make sure that kids understand why we're putting great food on their plate. They understand how certain foods are marketed to them in ways that are causing them and directing them to make a not so great choice. And also just really understanding where food comes from, how it gets to the grocery store, how it gets into a package, how it is grown quite literally from the ground and making its way onto our plates. These are just some of the issues, but I think the challenge here is making sure that we can have a good balance of depth as well as the breadth of the work. And I think, having a mayor like Mayor Adams that is centering food across everything that we do provides us with a great platform for that.
Thank you. Jenny, what about your work in New Jersey? Can you tell us a little bit about the key food systems issues that you're working on?
Sure. I saw a lot of New Jersey stickers out there. Say hello to my New Jersey friends. So in New Jersey, we recently, we're about a year old, started the Office of the Food Security Advocate. And what's really exciting about the office is we are within the governor's office, and it's an opportunity to serve as a collaborator between all the departments in the state. And as you can imagine with food, there's such a spectrum of programs attached to it. Some collaboration between all the departments that run different programming is really essential when we're thinking about a more holistic adoption of what food security means. And when we think about food security, a lot of times we will think about anti-hunger organizations, food pantries, food banks. We'll think of federal food benefit programs, so the welfare system, thinking about SNAP and WIC. And then we also have the food system and producers, consumers, retail, corporations. So all of that and the spectrum of that can make decision-making and priorities very difficult. So to get people in the same room and talk about what real food security means, which is not only economic access or physical access in our environment, but what types of food are offered? Are they culturally appropriate? Are they stable over a long amount of time? Do people have decision-making power in their food system? That's a really important piece of feeling that you have appropriate access to the foods that you need. So the office is really excited to steward those conversations and approach it I think the way I view it, with a bigger table, we need more people to come to the table to start figuring out some of the common challenges I'm sure we all see day to day when we're talking about a lot of people in very dense states, right? Diverse populations with a lot of different food needs.
Yeah, you both, I think, really hit the nail on the head with how multidisciplinary food systems work really is, and how a definition of community can really look differently. So, Kate, in your work, that the community that you're working with are government offices, and same for you, Jenny, but also working with community members as well to give them a voice. I was just wondering if you could talk a little bit more about the role that community plays, or organizations, in helping to shape the policy efforts that you're working on.
Yeah, I think about where I grew up in the middle of Pennsylvania, and there was a very sort of like clear community. And then having lived in New York for more than 20 years now, I think about, how challenging it is when we come to, researching and statistics, right? There's often one statistic that tries to represent the entire city, and nothing could be farther from the truth. And so the focus that this administration has on equity, to look at the deep layers of boroughs, right, or of neighborhoods, to find out how we can really support true community evolution and development as it relates to policies, right? And some of that, like one policy might be working quite well in one area, but needs some adjustments in another. So being able to be nimble and flexible to the needs of different communities. I love that you raised, the points around culture and ethnicity. When it comes to food choices, it is not one size fits all. And being able to be responsive to that and bring in the cultural flavors, the sensitivities, and traditions is a really important place for community. So for us, it's about representing and ensuring that equity is driving the evolutions and the creations of our policies.
So we are starting some really exciting research projects, and with those, they've been really intentional about incorporating community in defining what success means for them when it comes to food security. And also, a lot of what we're trying to do is have everyone come to the same understanding about what data means and what it doesn't mean. Data can be messy, data can have a lot of limitations to it, but it doesn't mean we should avoid it. It's also a tool to help our understanding. So a lot of that is just having conversations right now about what is data, why is it helpful, how can we take some fear out of it, and have it used as a tool. And I think something that I wanted to add when we think about equity in it is also equity in terms of longevity of our food system. Are we using farming practices? Are we building up a food system that's also going to be equitable to future generations, right? Are we just taking easy steps now, or are we being really thoughtful and mindful about other generations that are going to be relying on the food system?
Yeah, I love that. I'm wondering, as we start to think about wrapping up our conversation, if you could just talk about what's on the horizon for your work and what you see the future of this work to look like.
Speaking of longevity, we have last week released Healthy NYC, which is a plan that Commissioner Vassan has, with support obviously from all of our fellow commissioners. We've experienced a decline in longevity as a result of the pandemic. And whether that is from overdose, whether that is from the challenges around mental health and suicide, but also around chronic disease. And so from the Office of Food Policy, we are helping our health department to drive down deaths relatable to chronic disease by 5% by 2030. And this is all in the spirit and goal to have a longer, healthier, more fulfilling life. And so as we continue, actually, I think the legacy that Mayor Bloomberg really started with our food standards, with some of our trans fat bans, how we're really focusing on the upstream solutions and treatments to address chronic disease is part of our next frontier.
That's great. I totally agree with so much of what you said, and I think we're really excited to play that collaborating role. Our office is not necessary to create new, it's to celebrate strengths and good work that people are already doing. And when we have all those players at the table, one conversation we're really trying to steward is thinking about stigma and bias in our food system also, and those who the way we rely on what is available and accessible, making sure that it's really approachable, because we want people to be tapping into the resources that exist as much as possible to make sure we're uplifting the food system in a healthy and holistic way.
Great. As we wrap up here, just any additional challenges or lessons learned that you want to share from your work that may be applicable to fellows in the audience?
I think when we think of the challenge, who's not challenged in what they do, and looking at that more really from an opportunistic place. And I think, as we consider, the sort of really challenging statistics that are coming out of DC around food insecurity, and thinking about that not just from a place of making sure that people are fed tonight, but making sure that we are looking at the systems and the structures that are resulting in food insecurity and in poverty. So, for us, I think some of the greatest challenges that can also be reframing how we consider some of these problems. And so we have some programs that are really about affordable food access. In as much as we are also distributing free food, right? We're trying to make sure that all people have access to affordable foods. And so we have a really innovative program called Groceries to Go that provides people the ability to stretch their buying power in grocery stores. Some of the things around technology and home delivered meals that we learned from the pandemic. So I think taking a real close examination at the things that were made possible from the pandemic. Not everything was a challenge, right? But where were we able, particularly in government, to do things quickly with great success, and how do we keep those continuing in these times now that we're experiencing? Because the results of the pandemic we're going to be feeling for years and years and years to come, and our way that we're supporting all people to be able to thrive and again to live their best lives, some of that has to consider the methods and the approaches that we took during the pandemic.
I agree, and I would add, I think what I usually say when I talk about the beauty of public health is, when we talk about food, it's a common denominator across many of us, as many basic needs are. So I think the spectrum of need can seem insurmountable and really challenging, but I think there's also so much strength and innovation in how we can approach strengthening the food system. So I think we should be really open-minded to some of the creative programs that people have in mind, and thinking about what's valuable in that conversation, and not just about economic access, not just about physical access, but looking at people as human beings, right? And addressing those needs holistically, I think is a really exciting time for the field and for the sector as a whole.
Great, thank you both so much.